Are you ignoring subtle warning signs that your heart could stop working within the next 12 months? The terrifying truth is that thousands of seniors die every year from sudden cardiac arrest because they missed critical warning signs that their doctors either overlooked or dismissed as normal aging. In the next 18 minutes, I'll reveal 5 critical warning signs that most medical professionals don't properly explain to their patients, but could save your life if you recognize them and take immediate action. The 5th sign is so common that millions of seniors dismiss it as normal aging. Yet recent research shows it's one of the most dangerous predictors of sudden cardiac death within 12 months. Charles, a 73-year-old retired high school principal from Texas, felt perfectly healthy and passed his annual physical examination with flying colors just 3 weeks before his near-fatal heart attack. He collapsed while tending his garden and barely survived thanks to his neighbor's quick thinking. His cardiologist later discovered he'd been displaying all 5 warning signs for months, but neither Charles nor his primary care physician recognized their deadly significance. Warning sign 1. Unexplained fatigue that worsens over weeks. When exhaustion becomes your constant companion despite getting adequate sleep and rest, your heart may be desperately crying for help in the only way it knows how. This isn't the normal tiredness that comes after a busy day or physical exertion. It's a deep, overwhelming fatigue that makes simple tasks feel impossibly difficult and doesn't improve with rest or sleep. The American Heart Association has identified unexplained progressive fatigue as one of the earliest and most overlooked warning signs of impending heart failure and sudden cardiac arrest. Research conducted by the Mayo Clinic over 15 years followed more than 12,000 seniors and found that those experiencing unexplained fatigue were 4 times more likely to suffer a major cardiac event within 12 months compared to their peers who maintained normal energy levels. The study revealed that cardiac fatigue occurs when your heart muscle begins weakening and can no longer pump blood efficiently throughout your body, leaving your organs and tissues starved for the oxygen they need to function properly. Harvard Medical School researchers confirm that this type of fatigue progressively worsens over weeks or months as the heart's pumping ability continues to decline. The key difference between normal tiredness and cardiac fatigue is that normal tiredness improves with rest, while cardiac fatigue persists regardless of how much sleep you get or how little physical activity you do. Cardiac fatigue often feels like a heavy weight pressing down on your entire body, making you feel weak and drained even after sitting quietly for hours. You might find yourself needing to rest after climbing a single flight of stairs, walking to the mailbox, or even taking a shower, activities that never bothered you before. Consider Brenda, a 68-year-old retired nurse from Florida who began feeling exhausted every afternoon while reading to her grandchildren. Within 3 weeks, she could barely walk from her bedroom to the kitchen without needing to sit down and catch her breath. Her family physician attributed her symptoms to aging and stress, but 2 months later, she was rushed to the emergency room with congestive heart failure that nearly claimed her life. If you're experiencing unexplained fatigue that's getting worse over time, start keeping a simple daily energy diary, noting your fatigue levels on a scale of 1 to 10 each morning and evening. Pay attention to activities that now exhaust you but didn't tire you 6 months ago, and note any correlation between your fatigue and other symptoms like shortness of breath or swelling. Most importantly, schedule an appointment with your doctor immediately and specifically mention that you're concerned about cardiac causes for your fatigue, as many physicians don't automatically consider heart problems when patients complain of tiredness. The consequence of ignoring progressive, unexplained fatigue could be the difference between early intervention that saves your life and a sudden cardiac emergency that leaves no time for treatment. Don't wait another day to take your unexplained exhaustion seriously. Your heart may be running out of time to send you this critical warning signal. Warning sign 2, shortness of breath during normal activities. Do you find yourself gasping for air while doing tasks that never bothered you before, like walking up a single flight of stairs, carrying groceries from the car, or even talking on the phone for more than a few minutes? This type of breathlessness, called dyspnea by medical professionals, is one of the most serious warning signs that your heart is struggling to pump blood effectively throughout your body. When your heart can't deliver adequate oxygen to your lungs and other vital organs, your body compensates by making you breathe faster and harder in a desperate attempt to get the oxygen it needs. Harvard Medical School's landmark cardiac study followed over 8,000 seniors for 10 years and discovered that those experiencing shortness of breath during normal daily activities were 6 times more likely to suffer sudden cardiac arrest within 18 months. The research showed that cardiac-related breathlessness typically starts with activities that require moderate exertion, like climbing stairs or walking briskly, but progressively worsens until even gentle activities like getting dressed or preparing meals leave you struggling to catch your breath. The Cleveland Clinic confirms that this progression occurs as heart muscle weakness advances and the heart loses its ability to pump blood efficiently to meet your body's oxygen demands. The critical distinction between normal breathlessness and cardiac breathlessness is timing and progression. Normal breathlessness occurs during vigorous physical activity and quickly resolves when you rest, while cardiac breathlessness happens during activities that shouldn't cause significant exertion and may persist even after you stop the activity. Cardiac breathlessness often feels like you can't get enough air, no matter how deeply you try to breathe, and you may find yourself needing to sleep propped up on multiple pillows because lying flat makes breathing even more difficult. Another telltale sign of cardiac breathlessness is that it progressively worsens over weeks or months, with activities that once felt easy gradually becoming more and more difficult. You might notice that you need to pause halfway upstairs that you used to climb easily, or that you become winded while talking during phone conversations that never affected your breathing before. Gladys, a 71-year-old retired secretary from Michigan, first noticed breathlessness while vacuum cleaning her living room, but dismissed it as being out of shape. Within 6 weeks, she was struggling to breathe while folding laundry, and 2 months later, she collapsed from heart failure while simply walking to her mailbox. Her cardiologist explained that her breathlessness had been warning her for months that her heart was failing, but she had attributed it to normal aging and ignored the progressive nature of her symptoms. Start monitoring your breathing patterns during daily activities by noting which tasks now leave you breathless that didn't affect you 6 months ago. Pay special attention to breathlessness that occurs during activities involving your arms above your head, like reaching for items on high shelves or hanging clothes, as these positions put extra strain on a weakened heart. Create a simple weekly log of activities that cause breathlessness and note whether the list is getting longer over time. If you're experiencing progressive shortness of breath during normal activities, avoid the temptation to simply reduce your activity level and accept it as normal aging. Instead, schedule an immediate appointment with your physician and specifically request an evaluation for possible cardiac causes of your breathlessness, including an electrocardiogram and possibly an echocardiogram to assess your heart function. Ignoring progressive breathlessness during normal activities could mean missing your heart's desperate warning that it's failing and running out of time to keep you alive. Don't wait until you can barely breathe. Take action today while there's still time for effective treatment. Warning sign 3, swelling in legs, ankles, or feet. Swollen feet and ankles aren't just uncomfortable inconveniences that make your shoes feel tight. They could be a critical signal that your heart is failing and can no longer pump blood effectively throughout your body. When your heart weakens, blood begins backing up in your circulatory system like water behind a dam, causing fluid to leak out of your blood vessels and accumulate in your lower extremities where gravity pulls it downward. This condition, called peripheral edema, is one of the most reliable early warning signs of congestive heart failure and impending cardiac crisis. Johns Hopkins University researchers conducted a comprehensive study of over 15,000 seniors and found that those with new or worsening lower extremity swelling were 5 times more likely to be hospitalized for heart failure within 6 months. The American College of Cardiology confirms that cardiac-related swelling typically starts gradually in the feet and ankles, then progresses upward to the calves and even the thighs as heart function continues to deteriorate. Unlike swelling caused by injury or prolonged standing, cardiac swelling often affects both legs equally and worsens throughout the day as fluid continues to accumulate. The key characteristics of dangerous cardiac swelling include persistence despite elevation of your legs, gradual worsening over weeks or months, and the presence of pitting. When you press your finger into the swollen area and it leaves an indentation that takes several seconds to disappear. Cardiac swelling also tends to be worse in the evening after you've been upright all day and may improve slightly in the morning after lying flat all night, allowing some of the accumulated fluid to redistribute throughout your body. Another warning sign is when swelling suddenly appears or dramatically worsens without an obvious cause like injury, prolonged standing, or changes in weather. You might notice that shoes that fit perfectly last month now feel impossibly tight, or that socks leave deep indentations around your ankles that take hours to fade. Some people first notice cardiac swelling when their ankles appear puffy in photographs, or when family members comment on the appearance of their legs and feet. Russell, a 75-year-old retired mechanic from Oregon, noticed his work boots feeling tighter than usual, but attributed it to the boots shrinking. Over 3 weeks, the swelling progressed until he couldn't wear any of his regular shoes and had to buy larger sizes. His wife insisted he see a doctor, and tests revealed advanced heart failure that required immediate hospitalization to prevent a fatal cardiac event. Start checking your legs, ankles, and feet for swelling every morning and evening by pressing gently on your ankle bone and noting whether your finger leaves an indentation. Measure the circumference of both ankles with a tape measure once weekly to track any gradual increases that might not be immediately obvious to the eye. Take photos of your feet and ankles weekly to document any changes in appearance that develop slowly over time. If you discover new or worsening swelling in your lower extremities, elevate your legs above the level of your heart for 30 minutes and see if the swelling reduces. If it doesn't improve significantly or returns quickly when you stand up, seek immediate medical evaluation. Don't dismiss swelling as a normal part of aging or blame it on hot weather, too much salt, or standing too long without considering the possibility of cardiac causes. The consequence of ignoring progressive swelling in your legs and feet could be missing the critical window for effective treatment of heart failure before it progresses to a life-threatening emergency. Don't wait until the swelling reaches your thighs or you develop severe breathing problems. Recognize this warning sign and seek medical attention immediately. Warning sign 4. Irregular heartbeat or heart palpitations. Have you noticed your heart skipping beats, racing unexpectedly, or beating so hard that you can feel it pounding in your chest, neck, or throat? These sensations, called heart palpitations, could be your heart's way of warning you that its electrical system is malfunctioning and putting you at serious risk for sudden cardiac arrest. While occasional palpitations can be harmless, persistent or worsening irregular heartbeats often signal dangerous underlying heart conditions that require immediate medical attention to prevent fatal cardiac events. The Mayo Clinic's extensive cardiac arrhythmia research followed over 20,000 seniors for 8 years and discovered that those experiencing new or changing heart rhythm irregularities were 7 times more likely to suffer sudden cardiac death within 12 months. National Heart Institute studies confirm that dangerous heart rhythm problems, called arrhythmias, become increasingly common with age as the heart's electrical conduction system deteriorates and underlying heart disease progresses. These rhythm disturbances can prevent your heart from pumping blood effectively and may suddenly progress to lethal rhythms that cause instant cardiac arrest. Dangerous palpitations often feel different from the normal awareness of your heartbeat that might occur after exercise or during moments of stress or excitement. Cardiac palpitations may feel like your heart is fluttering, skipping beats entirely, beating irregularly like a drum with a broken rhythm, or suddenly racing without any apparent trigger like physical activity or emotional stress. You might feel these sensations in your chest, throat, neck, or even in your ears, and they may be accompanied by dizziness, shortness of breath, chest discomfort, or near-fainting episodes. The timing and pattern of palpitations provide important clues about their seriousness. Dangerous palpitations often occur at rest, when you're sitting quietly or lying in bed, wake you up from sleep, persist for several minutes at a time, or happen frequently throughout the day rather than just occasionally. You might notice that certain positions, like lying on your left side, trigger palpitations, or that they occur more frequently when you're dehydrated, tired, or stressed. Another concerning pattern is palpitations that are getting more frequent or intense over time, especially if they're accompanied by other symptoms like fatigue, shortness of breath, dizziness, or chest discomfort. Some people describe feeling like their heart suddenly starts racing for no reason and takes several minutes to return to normal, while others feel like their heart stops beating for several seconds before resuming with a hard thump. Clarence, a 79-year-old retired postal worker from Arizona, began experiencing irregular heartbeats while watching television, but dismissed them as stress from watching the news. Over 2 months, the palpitations became more frequent and intense, sometimes lasting for several minutes and leaving him feeling dizzy and weak. He ignored the symptoms until he collapsed in his driveway from a dangerous heart rhythm that nearly killed him, before paramedics restored normal rhythm with emergency treatment. Start monitoring your heart rhythm by checking your pulse at your wrist or neck for 30 seconds several times daily, noting any irregularities, skipped beats, or unusually fast or slow rates. Keep a simple diary of when palpitations occur, how long they last, what you were doing when they started, and any accompanying symptoms like dizziness or shortness of breath. Many smartphones now have apps that can detect irregular heart rhythms using the camera and flashlight, providing an easy way to document rhythm problems when they occur. If you're experiencing new or worsening heart palpitations, especially those that occur at rest, last more than a few seconds, or are accompanied by other symptoms, don't wait to see if they resolve on their own. Contact your physician immediately and request an electrocardiogram to evaluate your heart rhythm, and consider asking about wearing a portable heart monitor that can capture irregular rhythms over several days or weeks. The consequence of ignoring persistent or worsening heart palpitations could be missing the critical warning signs of a dangerous arrhythmia that could cause sudden cardiac arrest without any additional warning. Don't gamble with your life by assuming irregular heartbeats are normal. Seek immediate medical evaluation to determine if your heart rhythm irregularities require urgent treatment. Warning sign 5. Persistent cough or wheezing. That nagging cough you've been attributing to allergies, a lingering cold, or seasonal irritation could actually be your heart's final desperate warning that it's failing and running out of time to keep you alive. When your heart can no longer pump blood effectively, fluid begins backing up into your lungs, causing a distinctive type of cough that many people and even some healthcare providers mistakenly dismiss as a respiratory problem rather than recognizing it as a critical cardiac emergency warning sign. Cleveland Clinic's comprehensive heart failure research tracked over 10,000 seniors for 12 years and found that those with new or persistent cough that didn't respond to typical respiratory treatments were 8 times more likely to be hospitalized for heart failure within 4 months. The American Heart Association confirms that cardiac cough, also called congestive cough, occurs when fluid accumulates in the lungs due to the heart's inability to pump blood efficiently, causing irritation and inflammation that triggers persistent coughing and wheezing, similar to asthma or bronchitis. Cardiac cough has several distinctive characteristics that differentiate it from respiratory coughs caused by infections, allergies, or lung diseases. It's typically a dry, hacking cough that produces little or no mucus, though in advanced cases it may produce pink or blood-tinged foam that indicates severe fluid buildup in the lungs. The cough is often worse when lying flat and may improve when you sit up or prop yourself up on pillows, which allows gravity to help reduce fluid accumulation in your lungs. Unlike respiratory coughs that usually improve with cough medicines, throat lozenges, or allergy treatments, cardiac cough persists despite these remedies and often worsens over time as heart function continues to deteriorate. You might notice that the cough is worse at night or early morning when you've been lying flat for several hours, or that it occurs during activities that didn't previously trigger coughing, like talking on the phone, eating, or mild physical exertion. The cough may be accompanied by wheezing or a feeling of tightness in your chest that makes it difficult to take deep breaths. Some people describe feeling like they're drowning or suffocating, especially when lying flat, because fluid in their lungs interferes with normal oxygen exchange. You might find yourself sleeping in a recliner or propped up on multiple pillows because lying flat triggers severe coughing episodes that prevent you from sleeping. Another warning sign is a cough that developed around the same time as other cardiac symptoms like fatigue, shortness of breath, or leg swelling, suggesting a common underlying cause rather than separate health problems. The cough may worsen during activities that put additional strain on your heart, like climbing stairs, carrying packages, or even having animated conversations that require more oxygen. Ramona, a 72-year-old retired librarian from Louisiana, developed a persistent dry cough that her doctor treated with allergy medications and cough suppressants for 2 months without improvement. The cough worsened until she was unable to sleep lying down and began coughing up pink foam. Emergency room physicians discovered severe heart failure with dangerous fluid buildup in her lungs that required immediate intensive treatment to save her life. Start paying attention to any new or persistent cough by noting when it occurs, what triggers it, and whether it's getting worse over time rather than improving like a normal respiratory cough should. Try sleeping propped up on extra pillows for several nights and see if the cough improves. If it does, this suggests possible cardiac causes rather than respiratory problems. Keep track of whether the cough is accompanied by other symptoms like shortness of breath, fatigue, or leg swelling that could indicate heart problems. If you have a persistent cough that doesn't respond to typical treatments within 2 weeks, especially if it's worse when lying flat or accompanied by other potential cardiac symptoms, don't accept reassurances that it's just allergies or a lingering cold. Insist on cardiac evaluation, including chest X-rays and heart function tests, as early detection and treatment of heart failure can prevent progression to life-threatening cardiac emergency. The consequence of dismissing a persistent cough as a minor respiratory irritation could be missing your heart's final warning before complete failure and sudden cardiac arrest. Don't wait until you're coughing up blood or can't breathe. Recognize this critical warning sign and demand proper cardiac evaluation immediately. These 5 warning signs work together to paint a clear picture of a heart in crisis, desperately trying to warn you before it's too late to intervene with life-saving treatment. Recognizing even one of these signs and taking immediate action could be the difference between years of healthy life ahead and becoming another tragic statistic of sudden cardiac death that could have been prevented. The power to save your own life is literally in your hands. You just need the knowledge to recognize when your heart is calling for help and the courage to act on that knowledge immediately. Which of these 5 warning signs have you experienced recently, and what specific action will you take today to protect your heart health? Like this video if this information could save your life or the life of someone you love. Subscribe for more critical health information that could make the difference between life and death, and share this video immediately with other seniors who deserve to know these life-saving warning signs before it's too late.